And a Texas federal judge ruled employers are not required to provide coverage for HIV prevention pills, saying the treatment violates religious freedoms, making it unconstitutional. The decision has sparked backlash from advocacy groups who fear the ruling puts millions at risk.
Yeah, and that case was brought on by several plaintiffs, including two Christian-owned businesses who opposed a key provision in the Affordable Care Act that requires free coverage of most preventative treatments, including HIV drugs. The plaintiffs claimed they did not want to pay for health care that contradicted their religious beliefs, saying the drug encouraged same-sex relationships. Well, the drug maker argued the pill is not specifically for LGBTQ plus people and went on to say HIV does not target specific communities.
To get into this, NBC News medical reporter Erika Edwards joins us now. Erika, good morning. So advocates in favor of the HIV prevention treatment say this will have wide-reaching consequences beyond the pills themselves. So what other preventative treatments or health care programs could be in jeopardy?
Hi, good morning. Theoretically, this argument could be applied to any number of treatments, including birth control and vaccinations. In fact, the lawsuit included religious objection to contraception, to the HPV vaccine, as well as screening for drug use and sexually transmitted diseases. So certainly far-reaching implications. Zinkley, Stephen?
And Erika, many Democrats are speaking out about this decision, including House Speaker Nancy Pelosi. In a statement, Pelosi said, quote, "This disturbing decision amounts to open homophobia, unleashing unthinkable suffering and death, specifically among the LGBTQ community." Do you think that's accurate? And can you explain to us why PrEP and other HIV prevention treatments are a key part of the government's effort to stop the spread of HIV?
Well, first of all, as you mentioned earlier, HIV can impact anybody, full stop, right? However, most of the people in this country who take PrEP are men who have sex with men. Now, PrEP stands for pre-exposure prophylaxis. It usually comes in a pill form. It's taken every day. And when taken as directed, it can drive down the risk for contracting HIV through sex by 99%, especially among men who have sex with men. That's major. What's more, PrEP can also reduce the risk of acquiring HIV through injectable drug use by at least 74%. Stephen Zinkley, that's why PrEP has been so instrumental in bringing down the number of new cases.
And Erika, it is important to note that access is already an issue for HIV prevention. And according to the CDC, 66% of people who are prescribed PrEP are white, compared to just 16% of the Latinx community and 9% of black patients. So will this ruling widen the racial and ethnic gap there?
Undoubtedly. According to a federal HIV/AIDS program, about half of the people living in this country with HIV live in underserved areas. They have no health insurance, and they are low income. About half of that group are Black Americans. Compare that to that 9% that you were just citing. Another quarter of people in that group are white. So certainly HIV and AIDS activists say that this ruling will undoubtedly widen that gap. And they say that certainly it could have far-reaching implications.
Erika Edwards on that ongoing fight for HIV prevention. Thank you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.